Hi everyone, welcome to Trauma Talks. We have Dr. Dheenadhayalan sir, who is a mentor to many trauma surgeons across India, including me. So let us learn words of wisdom from him on this OTS platform. Sir, good afternoon. And I would like to ask you, you keep attending many trauma conferences, in fact organize a number of conferences. What do you really expect from a trauma conference?
First of all, Kasha, I wish you the best for this Orthopaedic Trauma Summit, and I see full of energy in the team, so I wish you all the best. And then when you were asking about the trauma conferences, see, like any of the orthopedic surgeon who comes out of post-graduation, they go through the first and foremost thing they feel as bread and butter is trauma. And because the trauma is the one that everybody takes it up, they have to do it very well. And the first thing they have to know is do no harm. On that basis, trauma conference that we all conduct must ensure that we impart correct knowledge, and then they take home the message that when they practice, they do no harm to any of the patients, and then the best outcome they deliver it. Because they all look up to all the faculties as their mentors, and then whatever we say, they feel that that is the right way to go ahead. And I am sure that when we send a message, and it should give a lasting knowledge to their careers.
Sir, now the epidemic is information overload. So, what to take up from this information? In fact, how to be selective and gain knowledge from this information overload which is present on social media, YouTube channels, including conferences. And for a young orthopedic surgeon, it is always confusing. So, what would you suggest?
See, like when I was a postgraduate and then came forward, because the knowledge was least available. We always used to go and ask many of our teachers what would be the best, and then we had selective ways by which we can go ahead. And also, if you want to look into any of the literature, we need to run from one library to the other to seek for the literature. But at present, everything is with the press of the button, it is available. And then there are many courses that are available, and every district and then every club is conducting the conferences. So there are many opportunities available. And also what was least practiced before, like cadaveric lab, is easily available nowadays. So the young orthopedic surgeons they get a knowledge in the press of the button, and then it is easily available. The only thing that required is the aptitude to learn, and then if they develop that aptitude and then the willingness to learn, they learn it. Otherwise, it is all available but it is not taken. So that is the scenario nowadays. But if the aptitude is nicely given to these young orthopedic surgeons, faculty teach them to take the right amount of academics and then the right way of taking the cadaveric labs and then getting a hands-on workshops, and I am pretty sure that they will develop into a good orthopedic surgeon. And also, like all these that are materials that are available has to be structured, and then that structuring mechanisms is the one that all these young orthopedic surgeons must learn. And then they have to take into right sites they must get into and then learn it.